Hello everyone. So we'll continue with the
Good afternoon, ma'am.
good afternoon. Yeah, we'll continue with the Dwividopakrama. Um, till now we discussed about Pipasa and how Langana is going to get benefited in different conditions. So to continue with, um, let us start with Maruta. Hope the PPT is visible, Kushi.
Yes, ma'am.
Yeah, okay. So, this in today's class we'll discuss about the Shamana type of Langhana. Okay, it is not the Shodhana type of Langhana; it is the Shamana. So first, we know that Chatushprakara Samshuddhi, Pipasa, Maruta, Atapau. We discussed about Pipasa in the last class. So today's class we'll start with Maruta. It is nothing but the synonym of Vata, and we know how this Martha we are going to take help in treating the conditions. So we know that it is not Martha is nothing but the synonym of Vata, right? And we know the gunas of Vata. Tatra ruksha lagu shitah kharaha sukshmaschalo anilaha. So this guna of Vata, that is ruksha, laghu, shita guna, etc., they bring about rukshata in the sharira. Hence, and we know that langhana, when we call it as langhana, when the procedure, medicine, drugs bring about laguta in the body, it is called as langhana. And we know that vayu has the guna of laguta. So, when we use Maruta or Vayu, exposure to Vayu as Chikitsa, it brings about Laguta in the Sharira. And we know that the definition of Ruksha, that is Yasya Shoshane Shakti sa Rukshaha, which brings about Shoshana in the Sharira, that is called as Ruksha. So how are we going to use this Vata at Langhana? By the guna of Ruksha, Laghu, etc. We are bringing about Shoshana, Laghuta in the body. When a person who is not Balavan enough to undergo Shodhana procedure, in such individual, we are going to expose him to Maruta, which will bring about shoshana in his sharira, maybe shoshana of medas, shoshana of kapha, shoshana of jaliya dhatus. So by the virtue of ruksha, laghu, khara, guna, etc., we are bringing about shoshana of medas, kapha, or other jaliya dhatus in the sharira. So it is usually indicated in madhya bala roga, and also balavan purusha with avara roga. A person is balavan, but the roga is having very small symptoms, like very few symptoms, and the bala of roga is very less. There is no need of that patient to undergo shodhana procedure. He can get benefited just by exposure to maruta. So this is how we are going to use this maruta for the treatment uh, aspect. Yeah, so we now know that the PPT is visible, right?
Yes, ma'am.
Okay. So next, coming to the Shamana Langhana, Shamana Rupi Langhana, it is Atapa. And when we hear this word Atapa, we know that it is one of the Niragni Sweda, right? When we study about Svedana Karma, there are two types of Sweda. One is Agni Sweda, where we directly use Agni to create Sveda. Maybe it is Nadi Sveda, Sankara Sveda, etc. But Atapa is used as Niragni Sveda, where directly there is no involvement of any process. No Agni is used, or else indirectly. For example, Lavana, we do Ruksha Sveda, right? But here, no dravyas are used. Only exposure to Atapa itself is causing Sveda in the Sharira. So Atapa is one of the Niragnisveda. And we know that how it is going to help. Agni Mahabhuta is playing its role here. And for Langhana, we know that Agni and Vayu Mahabhuta are predominantly present in Langhana Dravyas. So Atapa is having Agni Mahabhuta in predominance. And how it is acting? Agni, when a person is getting exposed to Agni, it increases the Agni in the Sharira. Because of the virtue of Ushnata, it is increasing Agni in the Sharira, and that in turn increases Pitta. Hence, the effects of Langhana could be seen because of the Deepta Agni. And when are you going to suggest this Agni as Langhana? It is best done during Hemanta Ritu. As other rutus in Grishma Ritu, the bala is less, and also the sun rays are very tikshna. And in Varsha Ritu, you can get no sun rays. So typically, and more like it is best to get Atapa during this Hemanta Ritu. Then how it is going to affect when a person is getting exposed to Atapa or sun rays, it brings down Vata and Kapha. And we know that Santarpanajanya rogas are predominantly due to Kapha and Medas. So exposing oneself to Atapa will bring down that Kapha. And because of the Ushnata, Vata will also come down. But you have to be cautious as exposing one person or patient to excess Atapa can aggravate Pitta and Rakta and can lead to diseases which are like Rakta Pitta or else Vata Rakta, etc. So we have to be very careful how long that exposure has to be done. And in Sushruta, we get a reference where it tells Vivatsvam Shoshayatyapi. That is, exposure to sun causes Shoshana. Here, the Shoshana refers to doshas like Kapha, Pitta, and also Medas, etc. The Jaliya dhatus get undergo Shoshana because of exposure to Atapa. So, I think this is clear. How are we going to use Atapa as Langhana? It is also seen in Madhya Bala Roga when the intensity of the Roga is not that intense, when the doshas are not present in Koshta, and where you see that there is Vata and Kapha involvement in the disease. And in Hemanta Ritu, we are going to use Atapa as one of the Langhana Chikitsa. Next is Deepana. We know that चतुष्प्रकार संशुद्धि पिपासा मारुत आतपौ the pachanani upavasascha. Next is pachana and upavasa. But even deepana is considered by Vagbhata as one of the langhana, shamana rupi langhana. We'll see how deepana can be used as langhana. Sharangadara quotes Pachetna amam vanhikritsha deepanam. What is deepana? Any procedure or any dravya which does vanhikrit, which ignites the vanhi, but it is not going to digest the ama. There's a slight difference between deepana and pachana. Deepana dravyas are those which ignite the agni but are not going to digest the ama. So Sharangadara gives one example, that is Tadhyatamishi. One example he has given. And uh, we see that Charaka, while explaining the Ganas, he has clearly mentioned Deepaniya Dashemani. But nowhere he has mentioned Pachaniya Dashemani. And if you learn about these Deepaniya Dashemani, what are the dravyas coming under it, Pipali, Mula, etc., you can use those dravyas for the purpose of Deepana here. And where are you going to use this Deepana dravyas? Kapha Pitta Vikara we are going to use. And Madhyama Doshavastha, as mentioned for other two, the same indication, that is Madhyama Doshavastha, we are going to use this as Chikitsa. And Harita has explained when are you going to use this Deepaniya Dravyas? He tells Aparanha Kala. You are going to give Deepaniya Dravya in Aparanha Kala as it is going to increase the Agni in its quantity. And Sharangadara has mentioned Bojana Madhye Deepana Dravyas have to be used, as Pitta gets Pradipta, that is the Pitta increase during the Madhya Bhojana. Right, as we start, it is the Kapha. As Bhojana, like one person indulges in Bhojana, after Kapha, it is the Pitta. Hence, Sharanga tells Bhojana Madhya, you have to take Deepana Dravyas. And it comes under Purva Karma of Shodhana. We know that when we plan Shodhana, either Vamana or Virechana, first line would be Amapachana, right? Amapachana. That is, by Deepana and Pachana, we bring Agni to the Deepta stage and then we administer Snehapana. So, Deepana, Chikitsa, it can be as individual itself you can do in cases of alasaka, visuchika, etc. Deepana itself is a chikitsa, Vishtabda, Jirana, etc. And it can be a procedure to Shodhana also. That is, before Shodhana, we bring uh, Agni to the normal stage by performing Deepana and Pachana. And of course, just like Langhana Dravya, Deepana Dravyas are also predominantly Agni and Vayu Mahabhuta in nature. So, this is about Deepana Rupi Langhana. Here we can use Deepaniya Dravyas, which are mentioned under Deepaniya Gana, and also Mishi, which according to Sharangadara, and we know that Ushna Jala is Deepana in nature, Grita is Deepana in nature. So such Dravyas can be used to bring Agni to Deepta stage. Next is Pachana. Pachana is one of the Shamana Rupi Langhana. Here Sharangadara tells, Pachet amam na van hi kuryat tadhi pachanam. See, very clearly mentioned. Deepana dravyas are those which does the deepana of Agni, but they are not going to um, digest the ama. But Pachana dravyas, they are not going to increase Agni, but do, they are going to do ama pachana. It is very clear now that Deepana dravyas act more on Jataragni, whereas Pachana dravyas act more on Dhatwagni and Bhutagni level. Okay, that is the slight difference. So when you give Deepana and Pachana Dravyas, you can see the combined effect. There will be Agni Deepti, along with that, there will be Amapachana, there will be Deepana effect to Jataragni, there will be Amapachana at the Dhatwagni and Bhutagni level. So we usually give Deepana Pachana together. And here also it is Agni and Vayu Mahabhuta predominance, no doubt. The best examples are Nagakesara and Meshashrungi. And even Pachana Dravyas are for Madhyama Dosha Avastha. Its action is more on Dhatu level as mentioned. And Sharangadara tells this has to be given during night time, and it is one among the Shashti Upakrama. Vrana Upakrama, when we see, it is one among that Pachana, and it is indicated in Taruna Jwara, Visuchika, Vibandha, Gaurava, etc. And in Charaka Vimana, fourth chapter, clearly it is mentioned that Pachanartham cha Paniya Mushnam. Ushna Dravya should be, that is, Ushna Jala should be given for the Pachana purpose in Jwara. So, simple, you need not administer dravyas also. Here, Pachana, even Ushta Jala will do. And Deepana, Grita, though not a medicated Grita, even simple Grita will do Deepana. Hence, all these Shamana Rupi Langhana, right? They are affordable in nature, right? When you are asking a person to expose himself to Vayu, that is Atapa, giving him Grita, asking him to take Ushna Jala, they are affordable in nature. So, wherever possible, please suggest Langhana Rupi, that is Shamana Rupi Langhana to patients who are not affordable. This is a flexibility which we see in Ayurveda. So that is about Pachana. That is, when we use Deepana and Pachana as combined, it gives more effect rather than using it individually. And just like Deepana, the even Pachana is Agni and Vayu Mahabhuta predominance, and it acts at the Dhatu level. And best examples are Meshashrungi, Nagakeshara, and Ushnajala. And Sharangadhara tells that Pachana Dravyas are to be given at night time. And when Deepana Pachana are combined, it gives more effect, and it is one of the Purva Karma before to Shodhana. When we administer Snehapana, we see that Deepana Pachana is given first to see Agni is Pradipta, and also there is Nirama condition. Then coming to Pachanan Upavasascha. This is one of the Shamana Rupi Langana, and we know that Upavasa is one of the Daiva Upasra Chikitsa. It would be very surprising to see that, right? When we see the shloka of Daiva Upasra Chikitsa, Upavasa is mentioned as one of its inclusion. So, we have seen that people do Upavasa on religious occasions, like maybe during Navaratri, maybe during Shivratri, or even during Dashera or Ramzan. People do Upavasa. It is a religious practice, and even in Ayurveda, Dayapashraya Chikitsa, it includes Upavasa. And when we see the effect of Upavasa, it is clearly mentioned Punya Pradahi, uh, it gives you Punya. So people do it keeping religious faith in mind. Along with that, there are other benefits also. That is Ama Doshaharo. It brings down the Ama. And Analakaraha, it increases Agni. And Spurtidascha, it gives some enthusiasm to the body. Indriyanam Prasadakaha, it brings a clarity for the Indriyas. Maybe Jnanendriya and also Ubhayendriya, it brings about that Prasadana effect. And where is this Upavasa indicated? It is indicated in Alpabala person, where he is not able to expose himself to Atapa, Maruta, or if he is not able to do Vyayama, Langana, that is Shodhana Rupi Langana, in such individuals you can advise Upavasa. Here you can advise Upavasa, that is Anashana Rupi, without giving any food, that is restriction, or else calorie restricted diet can also be indicated. And what are the indications? The Roga, Rakta Pitta, Alasaka, Visuchika, Shota, Grahani. If you go through all these chapters, Upavasa is indicated in a certain stage where the patient's bala is less, where you can see that the doshas are in Madhyama Avastha, then Upavasa is indicated as one of the line of treatment. But you have to know when to stop Upavasa, right? So clearly mentioned, when a patient he is able to withstand that hunger, and till he experiences fatigue, you have to advise. Once he starts developing fatigue, when there is little klama or shrama, then you have to stop it. How to? You cannot abruptly stop upavasa. So clearly it is mentioned krutvam shauchadikam, after undergoing shauchadikriya pratha lagu bunjita bhojanam. After when you want to break the upavasa, start with laghu bhojana. Okay, like you cannot just because he was in fasting, give something which is very nourishing, give something which is very heavy. No, you have to start with laghu bhojanam, bunjita laghu bhojanam, snigdham sumadarum ruchyam. It should be snigdha, it should have sneha, it should be madhura, because by upavasa there are chances that vata prakopa might have occurred. So snigdham sumaduram ruchyam, it should be ruchiprada. The palatability should be there. Mrudu annam sadhu saditam. That is, it should be processed and also very soft. Because of the upavasa, there might be little agnimandya, there might be vata prakopa, and because of klama, you have to take care that after you break upavasa, the food should be easily digestible. It should be palatable. Such things should be taken care of. And that was about upavasa. Then coming to vyayama, this is the last type of uh, uh, that is shamana rupi langhana. Here we know what is Vyayama, Sharira Ayasa Janakam Karmam, which brings about little Ayasa to Sharira, that is Vyayama. It is also one of Niragni Sweda because here no Dravya is used. By action itself, there is Sweda Pradurbhava. Just like Atapa, Vyayama is one of Niragni Sweda. And till what time you have to do Vyayama? Clearly in classics it is mentioned till Ardha Shakti. That is when the Sweda is seen in Lalata. There is increased respiration. When the patient feels Laguta in the body, you have to stop the Vyayama. And there are different types of Vyayama mentioned in Ayurveda, that is Niyudha, Bahuyudha, Adva, Padhagata, etc. by Shushruta. And also even Charaka mentions different type of Vyayama in Charaka Sutrasthana, where he mentions about Vyayama, that is Manasika, Kaika, Vachika actions when he mentions. Clearly, it is mentioned about various types of Vyayama a person can follow. And when we suggest a patient to do Vyayama, when you see a Stula patient, uh, along with dietetic restrictions, you say about Vyayama, right? So he will be having doubt how whether it is anaerobic, aerobic, or which type of exercise, whether it should be light, moderate, vigorous. All these you should consider because Staulia patients, though you see that increased medas is there, increased kapha is there, but there will be presence of vata in Staulia patients. So vigorous exercise are not recommended. It should be till Artha Shakti, and there should be gradual loss in weight. Hence, when you prescribe Vyayama, keep all these in mind. And it is better to do moderate Vyayama in Hemanta and Shishir Rutu and very light Vyayama in Grishma Adi Rutus, as the bala of the patient is very less. And in classics, we can see that Vyayama is a line of treatment in Urustamba, Staulya, Prameha, etc. So keep in mind when a patient of Prameha or Madhumeha comes, because Madhumeha is stage where Vata is involved. There is Dhatukshaya. Hence, Vyayama is a line of treatment, but see that the patient does Vyayama till his Ardha Shakti, and our like light exercise or walking is prescribed rather than vigorous exercise, as Vata Prakopa occurs in such individuals. And we know that the Falashruti of Vyayama is Laghavam Karma Samarthyam, Stairyam Dukka Sahiஷ்ണುತಾ, Doshakshaya Agnivruddhischa Vyayama Upajayate. Clearly, it is mentioned that Laghavam Karma Samarthyam, there is Laguta, Karma Samarthya, the patient will be able to do work, that is his Samarthya for doing some work is enhanced. There is Thairya, that is Sthirata in his body. Dukkha Sahiஷ்ണುತಾ, he is able to withstand injuries, he is able to withstand issues with his health, etc. Then doshakshaya, there will be kafakshaya, there will be medakshaya, agni vruddhi will be there. All these are the falashruti of Vyayama. Hence, now by seeing the falashruti, you can get a glimpse of how Vyayama can be used as line of treatment, right? And there are a few contraindications also. That is Bala, Vruddha, in case of pravata, when there is vata, increased vata, and then bahubhashikaha, who are having tendency to talk more, and kshudita, trushita, that is who is suffering from hunger, trishna, etc. In such individual, it is better to avoid this vyayama, or else maybe lagu vyayama can be advised. So next is after all this, what you can do is in which individuals the Shodhana Rupi Langana can be selected, in which individual Shamana Rupi Langana can be suggested. You now have that idea. And after you do that, what are you expecting? That is what Charaka says in Charaka Sutrasthana. Vatamutra Purishanam Visarge Gatra Lagave. He tells that there will be normal expulsion of vata mutra purisha there. If a patient is having constipation after langhana, a patient will be relieved of that. And then mutra, then vata, there will be no admana, bloating, etc. Second point, Gatra Lagave. He experiences laguta in his body. Hridayodgara, Kanta Asya Shuddhau. There will be proper Udgara. That is Amlodgara or such symptoms will be gone. Then Kanta Asya Shuddhau. He tells that there will be Shuddhi in the Kanta and also mouth. There will not be any tikta asyata or madhura asyata, etc. will not be there after samyak langhana. Tandra klamegate. He tells there is little mistake in the typing, but tandra klamegate. Tandra will be gone, klama will be gone after langhana. Swede jate ruchau chaiva. There will be pradurbhav of sweda. He experiences good taste perception. That is, before there may be aruchi, agnimandya, asyavayarasya, etc. Now he is able to perceive different taste. Kshut pipasa sahodaye. He is able to tolerate kshut and pipasa, or else he is able to appreciate kshut and pipasa. Kritam langhanamadishya nirvyate cha antaratmani. When a patient undergoes langhana properly, then nirvyata, the diseases will be reduced, or else the diseases will be gone. Nirvyate, there will be no vyata cha antaratmani. These are the samyak langhana lakshana. When you advise either shodhana rupi or shamana rupi langhana, then all these lakshanas can be seen. So, in a patient who is eligible for Langana, when you do proper Langana, these are the Lakshanas you see. And also, when are you going to do Langana? In Avastita dosha, that is when the doshas are in Koshta, and when the patient is having good bala to undergo that, and when you have um, a patient who is very obliging, then you surely can advise all these langhana procedures and follow. It can be either shodhana or shamani rupi langhana. So this is about langhana. In the next class we'll complete other Dwividopakrama like Rukshana, Brahmana, and Stambhana. These three we'll take in the next class and finish it. So, this is all about today's class. So, let me stop sharing. Anybody, any doubt?
No, ma'am.